Medical professionals receiving a hero's welcome after returning from Italy, where they deployed to assist with the coronavirus emergency, part of the country's health diplomacy that saw a similar medical brigade sent to South Africa in April.
Ustedes representan la victoria de la vida sobre la muerte.
You represent the victory of life over death, of solidarity over selfishness, of the socialist ideal over the myth of the market. With your noble gesture and your brave disposition to defy death to save lives, you have shown the world a truth that the enemies of Cuba have tried to silence or misrepresent: the strength of Cuban medicine.
Brigades that are the largest source of income for the government, bringing in between $6 and $7 billion annually. Payment from foreign governments, of which a small percentage, only around 25%, is paid to the medical workers.
We're
not slaves to anything. Here we are free. We do everything we want. We show solidarity. Solidarity that our country has with our interest. We go to other parts of the world to demonstrate that we are a powerful country and that nothing will ever bring us down.
A view that's not necessarily universal, at least according to this researcher who runs the Cuba Archive, a US-based think tank that seeks to advance human rights in Cuba, and who questions the positive narrative being espoused.
There's thousands of Cuban health professionals who have defected, including in South Africa, that could attest to this. And Cuba does not deny it. At 25% is what a health professional gets in the very best of cases. And I have yet to have one case where I say, okay, I'm convinced they did receive the 25%. Because what Cuba does is that they leave most of that in an account in Cuba. So let's say, for example, the new COVID brigade that just arrived in South Africa, where Cuba is getting $76,000 a year, if I remember correctly, per professional, and the professional is getting $1,400 a month. So let's say less than $15,000 a year. Most of that is deposited in an account in Cuba in a bank owned by the government, like the Cuban government owns all the banks, that they can only get access to if they complete the mission successfully and return. They lose it if they don't.
Despite the low COVID-19 caseload, less than 3,000 in a population of over 11 million, she argues that notwithstanding the country's healthcare system being universal and free, it does not always offer a high quality of care to ordinary Cubans, but is rather part of a huge propaganda apparatus controlled by a totalitarian state.
The doctors arrive with their white robes in a plane from Cuba, traveling dozens, of hours, who knows? Think about the logic of this. They arrive with the Cuban flags. They have to give speeches, ceremonies, with Fidel Castro pictures. What medical doctors do this? Doctors Without Borders, which has a huge program of really volunteer services, they don't charge for their services, that they help many countries in the world, has nowhere near the marketing campaign that Cuba has.
But concedes that on COVID, the country appears to have matters under control.
Cuba does have the ability to mobilize a lot of resources to control this, to visit. They started visiting homes, educating the population. They know how to do that.
Despite the criticism, at home and abroad, their medical professionals are hailed as heroes, as their low COVID numbers attest to.
We see once again that despite the difficulties we're going through, our country has always managed to control the epidemic and achieved figures that are reasonable relative to the rest of the continent. Despite not being developed countries, good control of the pandemic has been achieved.
And despite the success, Cuba's economy hit hard by the pandemic, with shortages of food, medicine, and basic products now a daily reality. Sherwin Bryceby's SABC News, New York.